Today is November 1st, 2024. My name is Charles Suter. Today I'm presenting part 2 of my series, Overcoming Depression, with a focus on its root causes. I have a reference, Undoing Depression by Richard O'Connor, PhD. My main message is that depression can be cured and prevented. This presentation focuses on methods for curing and preventing depression without the use of medications. But recognize that some depressions might need both medical and psychological interventions. A person can become depressed, even if they do not have a genetic predisposition, from inherited irrationality in their fundamental beliefs or due to traumatically stressful events. Change in all the known causes, such as irrational beliefs about life in general, or reprocessing specific traumatic events, can cure depression. Depressed people have similar physical symptoms, behavioral and thinking styles, and common mental attitudes and beliefs in common. So depression can be treated by managing and changing all the known root causes of depression, which are discussed in this presentation, such as the inappropriate coping mechanisms and thinking styles that lean towards the negative, pessimistic, and irrational. So Proposition 1, the most dominant of all the root causes are irrational beliefs. You must learn to manage them, your beliefs and your thoughts that trigger depression. Improper cognitive functioning is a major contributor to depression. And the number one improper cognitive functioning is the irrational belief that somehow I'm not good enough. I'm deficient. Something's wrong with me. That's the most dominant irrational belief that causes most depressions. Once you get into that state of thinking, you soon are in the hopeless, helpless, and purposeless thoughts loop that define a depressive state. So again, it's irrational, erroneous, and distorted beliefs that cause emotional distress, leading to depression. Most personality disorders can be treated simply by helping the patient correct well-known irrational, erroneous, and distorted beliefs, which ultimately are reflected in the patient's thoughts, actions, and feelings. With proper beliefs, you can avoid triggering the psychological stress response to adversity that depletes the serotonin, norepinephrine chemicals in the brain, which ultimately cause depressive episodes because it depletes some key chemicals in the brain which can trigger depression. The most serious irrational beliefs are those related to one's identity, specifically self-concept, self-esteem, self-confidence, etc. If a person believes he is deficient in some fundamental way, he will respond to life in very self-defeating ways, finding problems where there are none, limiting his choices unnecessarily, and effectively crippling his life due to limited choices. It's the distorted cognitive functioning that is most a cause of depression. So by changing these mental distortions, there will be fewer inappropriate beliefs, triggering thoughts of helplessness and hopelessness. Proposition 2. Another root cause of depression, and it may not necessarily be a root cause, but it may just be an association related to rational beliefs, but these are the complicit behaviors that perpetuate depression. Many depressives are isolated, they're perfectionists, and they're angry and guilty about things from the past. So if you want to overcome depression, you have to get out of your isolation, give up perfectionism, and focus towards the future as opposed to focusing on the past. You're going to learn how to behave in ways that are counter to a depressive state. Many depressive individuals, you can look at them and you just kind of see depression oozing out of their pores. You've got to learn to behave differently. You need to learn new ways of thinking and developing new rational beliefs, because it's your beliefs and your thoughts that are leading to depressive behaviors, and depressive feelings. So if a person has cognitive dysfunctions, he will respond to his circumstances inappropriately, causing problems for himself. If a person thinks he's deficient in some way, his behaviors will reflect that impression, and other people will respond subconsciously to these subtle messages. In effect, a person gets back what he puts out. Depressed people tend to self-isolate to protect themselves, if they're out in public, they make an utmost effort to behave and perform with perfection so as to avoid criticism, rejection, and condemnation, all of which he takes personally as a proof that he's deficient. So trying to be perfect is impossible, so there's always something amiss and imperfect in the mind of the person with low self-esteem. Once a person begins acting like a normal human being with healthy beliefs, he will have less aversion to dealing with other people without fear of conflict. His self-confidence will project a new attitude and will command respect for his efforts and less dependence on his final results. In other words, doing is being successful. Plus, negative thinking is just a bad habit that can be changed. Proposition 3. Now, due to irrational beliefs, irrational thoughts, complicit behaviors, oftentimes you're going to end up with the debilitating emotions. You need to learn to manage them. That, if you don't, will prevent recovery from depression. So you need to avoid emotional distress that contributes to depression. How do you do that? Manage your irrational beliefs. You'll need to reprogram them to avoid triggering a often melancholy response. Ideally, you want to develop a positive mental attitude towards life. It's okay to put on rose-colored glasses and assume the glass is half full. The depressed person suffers from considerably and unnecessary emotional distress due to his internal representation of how life works relative to the way he erroneously believes it should work. The discordant spectrum between belief and reality would cause all manner of negative emotions and sufferings to the point that the depressed person loses hope of ever getting out of his funk. Again, the remedy to this burdensome emotional distress is to change one's cognitive distortions, which might require the intervention of a therapist trained in cognitive therapy. So my final message here is that you can cure and prevent depression by changing your beliefs, which is the ultimate root cause. Just because you're trapped in the web of discordant thinking, behaving, and insufferable emotional distress does not mean there's no means of escape. You have to break out of the negative cycle. Knowing the most likely cause of your depression is pre-existing irrational beliefs that drives your thinking and behaving, which can be modified, should offer you hope of a cure. The fundamental cure of most depressions is to change all irrational, erroneous, and distorted beliefs that are at cause. Now, that will be the subject of the next presentation. So stay tuned for how to get out of and escape irrational beliefs. That's all for now. Remember to stay positive. You'll be happier, healthier, and live longer.